Do I have your permission to use this video for my online course, Assessment or Corrective Techniques for Movement Dysfunction?
Yes.
Okay, so we're going to go ahead and assess Sarah's hip hinge here. Now I'm going to have Sarah go ahead and bend forward, and we're looking for the elbow to remain in contact with her head, thoracic spine, and sacrum throughout the movement. Okay, all right. So we're going to move on to the first exercise in our progression. We're going to have Sarah lay down on her back with the down disc underneath her lumbar spine. Okay, Sarah, I'm going to ask you to go ahead and please activate your transverse abdominis. Push my thumbs away. Good. Now, I'm going to have you holding that posture. I'm going to have you go ahead and rock your hips anteriorly and posteriorly. We're going to do 5 reps. So the rationale here is that we really want her to be able to maintain a neutral spine, and we're starting in supine because we want to mirror the neurodevelopmental sequence. So we're having her activate her transverse abdominis and facilitate that active hinging or movement of the pelvis and hips. For the second exercise in our progression, we're going to go with the stability cup. This is going to go underneath her lumbar spine. Okay, we're going to inflate this to 40 millimeters of mercury. So I'm going to have you put your feet on the foam roller as well. Go ahead and activate it for me. Good, excellent. Okay, I'm going to ask you to please go ahead and lift your left leg and now your right leg. And Sarah's doing an excellent job here. What we're looking for is minimal excursion of the amount of pressure on the biofeedback cup with this exercise, and she's doing a great job. We've added a longer lever arm to the exercise, which means that there are more stability demands on the lumbar spine due to the fluctuation of the center of gravity. So she should be kind of getting close to the end here. Good. Okay. Third exercise in the progression. Now, Sarah, go ahead, and we're going to move to quadruped. All right, and we're going to place this ball behind Sarah. Good. Okay, Sarah, go ahead and activate your transverse abdominis for me. And I'd like you to just go ahead and drop your hips back onto your heels. So this next exercise is basically combined kind of a functional exercise with some mobility built in. So Sarah, her feet are flat on the floor. I'm going to have you go ahead and activate your transverse abdominis and try to keep a neutral spine. And then I'm going to have you go ahead and try to go from sit to stand with a neutral spine and come forward a little bit. Excellent. And back down to the table. And we'll do 5 reps here. Okay, so for our final exercise in this progression, we're going to have Sarah standing, and she will have the weighted ball in front of her. And we're just going to do an ordeal.